Well, celiac disease is thought to be a gastrointestinal problem, and basically it is, by definition. The gold standard to determine celiac disease, in addition to the blood test, is to do an examination of the villi in the lower intestine. And if they're damaged, then the doctor can diagnose celiac disease based on those results. But celiac disease can present in other ways, in terms of like DH, rash on the skin, and that person may not show the villi damage. Or celiac can present as ataxia, which is a clumsiness of gait or in movement, and that's kind of a neurologic symptom, and that person may not show villi damage. Celiac disease can present as psychological symptoms, and experts are now finding this, or more people in the medical community are understanding this, that there can be anxiety and depression linked with celiac disease. There's a wide range of symptoms that are present in celiac disease, and doctors and patients too need to be aware of, that you can have this unremitting depression. It may be a good thing to check to see if you're gluten intolerant or gluten sensitive, or if you have celiac disease, and if altering your diet might help with those symptoms. I was interviewing Dr. Stefano Guandolini, who's one of the leading celiac experts in the world, and he's with the University of Chicago Celiac Disease Center. And we were talking about the link between celiac disease and various neurologic symptoms and various psychological symptoms. And he was telling me about a case that he had where there was an 8-year-old girl who was a diagnosed celiac, but her parents had been giving her cookies on the weekend because she wasn't evidencing any of the gastrointestinal symptoms that you often see in celiac disease. And she was basically admitted to the hospital with hallucinations, and they were thinking of how to treat her because she was, presenting as being mentally ill. And when they checked her antibodies, they found that they were skyrocketed, and so he asked the parents about the celiac, the gluten-free diet. She'd been off the diet on weekends. He found out when they altered and got her back on the gluten-free diet, the hallucinating stopped and she presented normally. So, that just is one example of how celiac disease can present in ways that are kind of outside that normal parameter of gastrointestinal symptoms. Why didn't I get screened for celiac disease? Why didn't I screen my child for celiac disease? A lot of people who have celiac disease spend years being either misdiagnosed or undiagnosed, and they're miserable and sick, for years. So, I wish I had known that if you have some of these symptoms, that if you have unremitting anxiety, unremitting depression, if you suffer these symptoms despite all of the treatment, then you should be screened for celiac disease. That would be a big I wish I'd known.